Analysis of a 25-year-old patient with high 65 kilos who was admitted for ingestion of rodenticides of carbamate type El Campeón for 30 minutes with clinical signs of carbamate toxic syndrome, blood pressure 19/60 respiratory rate 292 beats per minute, temperature 6 grades, saturation 89%, heart rate 40 beats per minute, admission glucometry 116, extreme bradycardia, hypotension, cialorrhea, bronchial secretion, gastric lavage in performed with saline solution and charcoal activated is administered 1 gram per kilo. It is indicated to obtain double venous access. And fluid therapy started volume expanded indicated insertion of atropine on milligram every minute after 2 doses of the same improves his clinical condition, improves his heart rate, his blood pressure.
After 20 minutes of observation, Glasgow present neurological deterioration of less than 8. He considers the start of a rapid sequence to secure an airway. He indicates the start of midazolam 5 mg, fentanyl 17 micrograms, and becuronium 7 mg. After the rapid sequence, cardiac arrest present blue code is activated. Indication T telling doctor to start CPR and adrenaline 1 mg every minute until he returns to pulse. Secure airway with orotracheal tube number 7 after applying lidocaine spray after the 5th cycles of resuscitation. Spontaneous circulation returns. Your BP is below 65, which is why the arterial physical indicates the start of titratable noradrenaline, beginning at 0.05 micrograms kilograms minutes, and after titrating up to the maximum dose by the peripheral returns 0.1 micrograms kilograms minute. With multisense effect, hypotension persists, which is why the start of vasopression in indication at 0.01 ounces minute.
Indicates gastric protection and continued observation. The viscosity trace shows irregular RR, absence of the P wave, and heart rate of 150 beats per minute. The patient is considered to have atrial fibrillation with rapid ventricular response. A bolus of amiodarone 150 mg is given and continued infusion continuing up to 1 gram in 24 hours. Arterial gas is reduced where metabolic acidosis is evident, pH 6.5, bicarbonate 3 with hyperkalemia. They indicate calcium gluconate 10 milligrams every 8 hours. He states that he doesn't wish to start the polarization solution yet. Bicarbonate sodium 1 milliliter kilogram.
After 20 minutes under observation, it is visualization in viscosity, ventricular tachycardia, and borderline tension figures are evident. The speed multisport. It indicates the onset of magnesium sulfate with subsequent reversal of arrhythmia and stabilization of tension figures. The clinical examination is evident with grade 2 edema in lower limbs, so the start of furosemide 5 mg every 6 hours is indication taking in account tensional figures. Patient in regular general condition with evident clinical impairment, tension figures with PAN 65. During his stance in resuscitation, Sunderland present episode of generalized clonic tonic convulsion. So, doctor trained indication penicillin low bolus 1 GR for impregnation with stabilization of the convulsion. Time later present again for cardiac blue code is activation. Medical train indication the onset of adrenaline every minute until it returns to spontaneous circulation in terms of compression and ventilation 15 for 2. After 5 cycles circulation in the clinical evidence paint with full pupils with mutilated and cold legs opposite cornea training doctor considers patient with early cadaveric 6 indication to suspend resuscitation Maineurus suspend infants declared date explained to relevant.